Hello again, Dr. Webster. This is a device we use in the practice. It's called a dynamometer. This actually tests the strength of your grip, and the needle registers there. So this is one of the standard things we do with every new patient. If they come in with any kind of neck or upper back problem, we'll test their hand strength. And I want to explain to you how your fist is made and how your grip strength. So what produces the grip are these muscles right here. These muscles in your forearm. When you tighten your fist, those are the muscles. Now, these muscles get their energy or nerve supply from your neck. For example, we had a patient just today. This gentleman came in, he has some neck problems, and we did our test. And then after a patient has been with us for about a month, we do the exam again. And so we do this test again. This gentleman's hand strength almost doubled. And so I see that frequently, so I want to talk about it. How would you getting adjusted help your grip strength? Because the nerves in your neck, they carry impulses, right? They send signals, electrical signals from your brain down into your arm, into these muscles. So if you have pressure on these nerves, for whatever reason, it could be an accident, it could be sleeping the certain way for a long time, any kind of pressure, it could be in front of the computer, anything that puts pressure on these nerves will decrease the flow of nerve impulses, and that can weaken the muscles. So after a month or so, getting adjusted and getting these spaces opened up, we retest. And that's why almost every time we get improvement. Sometimes it's quite significant because the better nerve supply, the better muscle contraction. So it's like this dimmer switch I use for demonstration. If your brain sends out an impulse through that nerve and there's pressure on that nerve, then instead of having impulse like that, you may only have that. So whenever I open the vertebrae and I take the pressure off the nerves, you get better nerve conduction, better blood flow. And so we see that in the muscle system all the time because we do muscle testing. So I want to apply what I just said to this chart. Most patients that come in get their full spine adjusted. I do. So that means I'm working at every level to make sure that I'm opening the spaces so the nerves don't have any pressure on them, so the nerves can carry the best impulse possible. And just like I just demonstrated, it improves muscle strength. Well, see, these nerves feed all of the organs and glands and muscles in your body. So I think it's very logical, and we've seen this, that when you do get adjusted, it does help your body function better, just like it helps the muscle strength. So it's just another reason to find a good chiropractor and get adjusted on a regular basis, because gravity is going to compress. Watch people as they get older. They get shorter, they get stiffer, they get slower, they get weaker, and then they start having all kinds of health issues. There's a lot to be said about keeping your spinal column open and in line and moving the way it should. Thanks.